This here is a model of a reverse shoulder arthroplasty. We call it a reverse because the ball and socket are actually switched from what normally occurs in the human body, where the ball is actually on the top of the arm bone or the humerus. This functions biomechanically in a very different manner than our normal shoulder. This is a device that actually came from France. It has been approved by the FDA since 2004. And the beauty of this implant is you can now treat arthritis in patients that don't have a rotator cuff that's functioning. You can also use it in older individuals where this upper part of the bone may have been damaged from a previous fracture, or they may have had a prior shoulder replacement done in a traditional sense that has failed. And so this is a great replacement for an older individual if you're doing a revision or a redo surgery. So this reverse shoulder differs from a traditional standard total shoulder where we have the ball actually on the top of the humerus, on the top of the arm bone. And so this is what is known as a traditional shoulder replacement, where the ball and socket, much like other joint replacements in our body, whether it's your hip or your knee, this very much reproduces our own anatomy. The difference between this replacement and the indications for the reverse that I mentioned is this needs an intact rotator cuff to function. And that's something that certainly in a revision or redo setting, or in a much older individual, they may not have an intact rotator cuff. So the reverse arthroplasty, the reverse replacement, has really opened up many more opportunities and options for that older patient without a functioning rotator cuff.